Good afternoon, YouTube. Today is Wednesday, August 13th, around 4:15 p.m. I'm making a quick video. This is going to be an Ebola, I want to call it alert, but it's not really there just yet. But this is some serious information that everybody needs to be aware of. If you've been following my channel for the last week or so, some pretty drastic information has been brought to light. As well as if you follow my blog, or Saving the Truth movement has a blog too, actually a full website which is being redone under the direction of Jason Knight. So I'll put some links in the comments in the description box below, but that's not what this video is about. In talking with Jason, we were reviewing the transmission of Ebola. Some very disturbing information became readily apparent, and I'm going to go through that with you guys. Just a little look back in history. Let's go back to July 31st right here. July 31st, August 2nd, I'd actually taken this stance based on my medical knowledge and all of my, 25 years experience about viral transmission, infection, etc. That Ebola was not going to be a huge problem. I actually did a video, it's still up, you can still see it. That was my stance as of August 2nd. I've since reversed that stance. I believe at this point Ebola does possess several factors, and the way that this virus appears to be spreading, which is very asymmetrical to where it should be spreading in a more clustered pattern, spreading outwards. It's not doing that. In fact, yesterday I posted a video, and let me show you which one. It was this video with the agent from Customs and Border Patrol. He actually reviewed the same thing that I just stated, that the virus of the Ebola virus, the one that's out in West Africa, appears to be as if it was planted in several different areas and then spreading outward from those three areas. It doesn't make sense, because normally with the Ebola virus, and historically this has been the case, I'll actually pull up a map for you so you can see it. You start with one small cluster area and it spreads outwards. In this scenario that we've had since March of this year, it's actually 3, 4, or 5 different epicenters, if you will, and they're spreading out from those locations. It doesn't make sense. This agent, Taylor, actually, his thinking is that it was actually planted there. I don't know that I would take it that far, but it looks that way. Okay, well, of course the map I'm looking for is no longer here, but this is actually a different one, just showing the distribution of Ebola hemorrhagic fever distribution from 1976 to 2014, showing that basically tight clusters, and most of the major outbreaks were in Congo. If you're going through, you can see the list off here to the right. Congo appeared to be the ones that had the most infections and mortalities. And right now they're saying 1176 is confirmed in the lab and 660 deaths. Again, these are only confirmed cases through laboratory confirmation. So what we're looking at is right here. Okay, so since that map is no longer available, let me just move on. The basic thing that we want to get across right now quickly, and there's going to be an article to follow that's going to give this information really pointed out clearly, is that essentially what's happening. The Ebola virus, in its natural habitat in Sudan or tropics of Africa, it's basically suppressed in terms of transmission from person to person by the climate. And this is something that's found in this this journal article that was done August 1995 by Johnson, Jacks, White, and Jarling. It goes over actually how the virus is transmitted airborne in monkeys. This is in a lab setting. Now, why is this important? Well, this is important for a couple of reasons. First of all, is that it clearly demonstrates that Ebola is airborne transmittable. This is something that initially I was saying no, and I've reversed it since because I found too many articles to the contrary saying that yes, you can get it via the air. It's very easy to get through the air, as a matter of fact. The upper respiratory system and the bronchioles in the lungs seem to be where the Ebola virus seems to harbor. This is confirmed on histology reports. They see the Ebola virus antigens as well as pneumonia or pneumonitis or bronchitis, pulmonary edema, quite a few different conditions resulting from the Ebola virus when these monkeys actually inhaled microparticles of the virus. They did come down with the virus. They were symptomatic. They did have to be put to sleep, the ones that caught the virus, and the control group did not get the virus. So that tells you that the study was done properly. The monkeys that were exposed to the virus caught it. The ones that were not exposed to the virus didn't catch it, and the virus itself was lethal. It was also it was able to be replicated, so the study was valid. Okay, so this actually goes without a shadow of a doubt. Airborne transmission is possible. So now to the critical part, the climate of Africa itself. The virus in the lab was easily transmittable because the lab conditions were 24 degrees Celsius at 40% relative humidity. 24 degrees Celsius is about 75 degrees Fahrenheit. Perfect ideal setting for computers and everything else, but it's ideal for lab settings and apparently ideal for transmission of the virus through the air. What this investigation also showed was that in the natural setting of the villages where the Ebola outbreak was in 1978, was that the transmission from person to person was not well established in the natural environment. And in Africa, the natural environment is above 75 degrees Fahrenheit with a relative humidity of about 90%. In fact, just to show you, this is a map of Africa right now, right today, with a relative humidity on the western part of Africa of about 90%. Now, this was in my video the other day. The travel restrictions, or guidelines rather, there are no restrictions, but the guidelines for travelers from the United States to those areas that are experiencing the Ebola virus right now, they're telling you to avoid hospitals where Ebola patients are being treated. Well, what do you find in hospitals? You find controlled environments. And generally what you're going to find in a hospital setting is a temperature of between 72 to 76 degrees and a relative humidity of about 40 to 50%. Basically, the environment is controlled, it's air conditioned, so you're going to have low humidity levels, or low relative humidity, or dew points. So therefore, that's probably why this statement now was put in there. I did that in my other video. I'll put a link to that as well, where I was describing some discrepancies I noted on the CDC website. This was one of them. This is starting to make sense now, because the ideal condition for transmission appears to be 75 degrees, 40% relative humidity. The problem, let's get to that. So basically the problem is we have the freedom of travel from all West African areas into and surrounding the New York City metro area. That includes Newark International Airport and JFK. Air France being one of the major airlines that services that area. There is no restriction at all from anybody leaving West Africa and coming into the New York City area. Why is this a concern? Well, because during the fall, the average temperature hovers between, well, this is actually for October, but in October you can see the temperature's right around 70, and in September it's between 75, 76, dropping to 70 degrees, 67 degrees, and the relative humidity is around 56%, dew point around 57 degrees. So that puts us right into the same danger zone as you would have in a laboratory setting. That's why this video is being made. The conditions for a perfect storm, as has been explained by a few people, and I'll put some links as soon as I get them. I'm doing this very quickly. But a perfect storm is actually brewing. All it's going to take is for a few travelers from West Africa to be infected with the virus, be asymptomatic, meaning they don't have symptoms currently, So they're able to get past any BS screening that's actually taking place on the West African side, able to get into America because they don't have symptoms on the American side. They're able to get into the New York City area by the fall, when the temperatures hover between 70 and 75 degrees, and the relative humidity and the dew points are around 45 to 57 degrees, and the relative humidity is between 56 and 90%, being really high. It's not usually 90%, it's generally somewhere right here, around 70%. So guys, that does set up a perfect storm. What else happens in September and October? We have back to school. We have a lot of more indoor activities. It's not going to take much for this to spark off just the right way. Now, what happens if I'm wrong? Well, what happens if I'm wrong? Nothing. Nothing happens. Absolutely nothing. You get to say I'm wrong. But if we're right, then it makes sense to take some precautions. And what those precautions are going to be is something we're working on, because I do think that there is the potential for this to spread a little bit quicker and a little bit easier than the CDC is actually saying. Remember, this still is a biosafety level 4 virus, meaning, according to the CDC, let's take a look. Biosafety level 4, according to the World Health Organization, is a pathogen that usually causes serious human or animal disease and can be readily transmitted from one individual to another directly or indirectly. Effective treatment and preventative measures are not usually available, but this is the key right here. Readily transmitted from one individual directly or indirectly or indirectly. And so that means what? That means it doesn't necessarily mean you need to touch somebody. That means you can be around them. Okay? Biosafety level 4. This is the worst pathogen that you can be exposed to. No treatment, no cure. So I'm not taking this as lightly as I did before. And it's only been about a week or 11 days. I'll keep you updated. I'll post the link to the article as soon as it's up. And stay safe.